Alright, so continuing with our appendicular skeleton, we've moved from the upper to the lower. Now the interesting thing about the lower is that it's pretty similar to the upper. Not exactly the same, so given that we walk upright as opposed to on all fours, right? So the scapula and the humerus, that pectoral girdle, is a little bit different. We have more mobility there compared to needing more support down at the pectoral girdle, more weight bearing, etc. But if we look at the bones of the appendage, we'll see some similarities, right? One bone more proximal than two, then small bones of the wrist or ankle, and then bones of the hand and foot, bones of the phalanges. So we'll see a lot of similarities there. Okay, so pelvic girdle. So the pelvic girdle is also called the hip girdle. So we have these two hip bones, also called the coxal bones, also known as the os coxae. As well, these form the sides and the anterior side of the pelvis, and then the posterior side, we actually have the sacrum. So here's our sacrum, that triangular sacrum that we see here. So these are the coxal bones, one here, and then one on the other side. Now the hip bones of the coxal bones are actually three fused bones that have come together. So you can see how they're labeled: ilium, pubis, and ischium. If we view them from the sides, a little bit more clear because they're color coded here. So this top part is going to be the ilium. This posterior part here is going to be the ischium. And the anterior part here is going to be the pubis. So they all contribute to this major depression right here, which is called the acetabulum. So the acetabulum is the big socket that the head or ball of the femur goes into to form that hip joint. So again, much deeper compared to what we saw with the glenoid cavity of the shoulder, more stability. All right, so if we look at these three fused bones of the os coxae, what we find is with the ilium, for instance, again, anterior side is going to be over here. See all these things labeled anterior side? Anterior side, this is the front, this is the back. And we can see, like with the ilium, there's an anterior superior iliac spine. It's a long name, but it's all in the name, right? On the front, at the top of the ilium, and a pointy part that sticks out. When we go down here, this little projection right here is the anterior inferior iliac spine. And this major part right here is called the crest, like the crest of a wave. And then this major extension, this wing-like extension here, is called the ala. When we go posterior, we can see again another little point up top, posterior superior iliac spine, another little point down below, posterior inferior iliac spine. And here we see a deep notch, greater sciatic notch. So sciatic reminds you of sciatica, sciatic nerve. So one of the largest peripheral nerves of the body comes out of the spinal cord, goes down the posterior part of the thigh. And so that notch is where it passes through. So greater sciatic notch. Then down here, we actually get down to the purple section, which is the ischium. And now we have an ischial spine instead. And inferior to the ischial spine, we have a lesser sciatic notch. So greater sciatic notch up here, lesser sciatic notch down here. Also associated with the ischium, we have this flat area here. So this is a tuberosity. So a tuberosity is a projection that's kind of rounded. Now the weird thing about this bone, you know, you look at the ISCH, and we saw CH before. Sometimes you see that as a ka, sometimes you see that as a cha. And so with the S, sometimes, you know, you think of it as school. And so technically it's like ischium. It's something that I've had to learn through time as well, where it's not ish like a soft sound, it's more isk. So ischium and ischial, etc. I don't know, to me it sounds weird. But in any case, ischial spine, lesser sciatic notch, and then the ischial tuberosity. This right here, that roughened section, that's your butt bone. That's what you're sitting on. That's what I'm sitting on, at least. So additionally, we find, remember with the mandible we had a ramus, that kind of straight area. We have an ischioramus, which leads to a pubic ramus, which is the inferior pubic ramus. There's another straight shot right here called the superior pubic ramus. And then what we find is all three of those bones form this round structure right here, which is called the obturator foramen. So the obturator foramen is a big hole. Now, when you look at it, you're like, what is a spinal cord go through there? I don't know. I've never seen that big hole, right? So it's right here and right here. There are things that pass through that hole, blood vessels, etc., nerves, but they're much smaller. So it is interesting that there's such a big hole there. It may be that it lightens the pelvis a little bit to have such a big hole there, but it's not one massive nerve or one big artery going through there. Okay, so this is just a reverse angle here. We can see where the sacrum articulates here. We can also see the iliac fossa, right? This bowl, if you will, on the inside of the ilium that we see in there. And when we put them all together like this, you start to get other structures. So for instance here, between the two pubic bones, you get what's called the pubic arch. And knitting together the two pubic bones, we have a pad of fibrocartilage, again, which is called the symphysis pubis, or pubic symphysis. In addition, with the pubic bones, we have the pubic crest that we see here and here. Okay, now with the pelvis of males and females, they're actually different, and they're associated with structure and then function, right? So we see on the left here a typical female pelvis, and on the right a typical male pelvis. So a female pelvis has lots of different characteristics that tell it apart, right? You can see how the ala are much wider spread. We can see how the pubic arch is greater than 90 degrees compared to less than 90 degrees. You can also look, if you look at the pelvic brim and the pelvic outlet, we can see it's much smaller in a male and rounder compared to more of the heart-shaped outlet when we look at the female, right? Because that's the birth canal. We want to make sure that that's nice and open. Associated with that, when we look at the male outlet, we can see how the sacrum curves and the coccyx curves forward anteriorly, whereas the female doesn't quite do that as severely. So creates more of an opening for the birth canal that we see there. So telling the difference between the female and male pelvises is something that you'll need to do in lab as well. Much bigger birth canal here, no birth canal there. All right, move on to the lower limb. Again, we're going to see similarities between the upper limb and the lower limb, but it's going to be a bit more robust with the lower limb because we have to support the weight of the body. So here's our one bone of the thigh. Now remember, from the hip to the knee is the thigh, from the knee to the ankle is the leg. So this is the one bone of the thigh. We have a big head, much more rounded head compared to the humerus. It has a little indentation to it called the fovea capitis. It has a narrow area, which is called the neck. We see that all similarly. Now realize over here, this is the anterior view. This is the posterior view. We can see that there's some bumps there. There's a small bump down below and a big bump up top. So the one up top is called the greater trochanter, and the one down below is called the lesser trochanter. So I have to tell you, it's kind of a funny story. When I first started teaching anatomy and physiology in 1994 as a master's student at San Diego State, I tell you, I was studying more than the students for sure. And so it's one thing to learn how to spell it, but it's also something you need to know is how to pronounce it. Like we talk about like ischial and ischium and stuff like that. In this case, the very first time I was teaching it, I had some undergraduate TAs with me. We were teaching it in lab, and I was going through and pointing things out, and I said, oh, here's the greater trochanter, and here's the lesser trochanter, and my undergraduate TA kind of perked up his head, and he's like, so, trochanter, yes, greater trochanter, lesser trochanter, as well as the intertrochanteric line, or crest on the posterior side. All right, we work our way down. Remember in the humerus, we had a deltoid tuberosity. Now we have a gluteal tuberosity on the posterior side where gluteus maximus, etc. is going to insert. Now, when it's a roughened area, we call it the gluteal tuberosity. When it becomes more narrow, we call it the linea aspera, a line that goes down the posterior side. This kind of splits, and it leads down here to the condyles. Now remember with the humerus, we had two bony projections pointing inferiorly and two going out to the side. We have the same thing here. So those that are pointing inferiorly we see here are the condyles, medial condyle, lateral condyle, right? And then pointing out to the sides, we have medial and lateral epicondyle. So remember, you got to be able to tell the difference between left and right. The head always goes medial, and in this case, again, much like the humerus, we have a shallow depression for the patella on the anterior side, but we have a much deeper depression here on the posterior side. This is called the intercondylar fossa, between the condyle fossa depression. Okay? All right, so that is the femur. Here is, over here, we see the patella. This is called the sesamoid bone. It grows within that tendon and ligament. And what we find is it looks like a sesame seed. That's one of the reasons they call it a sesame or a sesamoid bone, and it has a point to it called the apex. So the point always faces inferiorly. We'll talk about in lab a little bit how you can tell the left and right with that one. It has to do with these facets like we see on the posterior side. Okay, when we get down to the bones of the leg, we have two bones, fibia and tibula. No, remember, one letter difference. One letter difference, and we can't tell the difference between these two bones, right? Tibia, fibula. So the tibia is the smaller term, but it's the biggest bone, like we see right here. The fibula is on the lateral side, longer name, smaller or thinner bone. Okay, so when we look at the tibia, this is the shin bone from the song. Okay, so there's a lot more aspects to the tibia compared to the fibula. Also have an interosseous membrane, much like we saw between the radius and the ulna. All right, so with the tibia, on the proximal end, what we have is tibial tuberosity. So this is when you kneel down, that's your knee, okay? That's what's impacting the ground. You also have condyles again, lateral condyle, medial condyle, and an intercondylar eminence, right? Your eminence, your highness, somebody who's high up, intercondylar eminence up there at the top. All right. We also, on the distal end, we have a projection that's called the medial malleolus, like we see here. What side is it on? Medial side. So that helps us to orient it here. Tibial tuberosity on the anterior side, medial malleolus on the inside. Now when we look at the fibula has the lateral malleolus that matches up with the medial malleolus of the tibia to form the ankle joint. So we have a lateral malleolus on the fibula, and up here we have the more rounded head that forms a joint here with the tibia. Now, one other thing, we talked about a callus fracture. There's also a Pott's fracture. So Pott's fracture is where you have a broken end of the fibula or even the tibia or both. So you really impact that ankle. All right, lastly, when we get down to the foot, it's pretty similar to the hand. So what we have now is instead of carpals, we have tarsals, like toes. They're not toes, but they're like near the toes. So remember the T for tarsals. So these are unique irregular bones. Some of them irregular, some of them are just the actual short bones, about as high as they are wide. And what we find is calcaneus, that's your ankle bone, right? So the calcaneus, we have the talus, that's what actually forms the ankle joint. So we can see it here. Here's the talus right here. Here's the calcaneus right here. Then we have the smaller ones, right? We have the navicular, like we see here, the cuboid, which is here, and then we have a lateral, an intermediate, and a medial cuneiform. So we can see some of that. Here's the navicular, here's the medial cuneiform. We're looking on the medial aspect of the foot. When we get back again to here, we look at the bones of the foot, same way that we named them for the bones of the hand. 1, 2, 3, 4, 5. And here we call them metacarpals, now we call them metatarsals. Now the wacky thing is when you get out to the toes actually have the exact same name as the fingers. I don't understand that. There should be something different, right? But it's not. You use the numbering system, 1, 2, 3, 4, 5, and then it's proximal, distal for the first one, for the big toe, and then it's proximal, middle, and distal for the other ones. Okay? So just different views of the bones of the foot and the ankle. Now these bones, you see they're not all flat, unless you have flat feet. They form different arches. So you can see there is longitudinal arches on the lateral side and on the medial side, and then there's a transverse arch that goes across this way. So these bones help to hold that in place. All right, so just a couple things about the development of the skeleton. We talked about how it starts at about 9 weeks. It starts ossifying, etc., from the cartilage, mold, etc. Another thing that happens, like we said, some of these start out as 2 bones and they fuse into 1. And so the skull, as the brain is growing, etc., the skull is one of the largest things that has to pass through that birth canal. So it's good that we have some flexibility to it. Oftentimes you can tell a baby that's gone through a vaginal birth because they may have more of a pointed head for a while, as opposed to a C-section, which has a nice round head. But we have these soft spots that are called fontanelles. So you can see they come at the place where some of these bones join. And there's a few of them. The largest one is the anterior fontanelle. So that's forming at the junction between the parietal and the frontal bone. See those frontal bones coming together and fusing? So that's the biggest one. That's the one where you can actually feel it very well. You can actually see the baby's pulse through there if they don't have a lot of hair, right? Don't go pressing that button too much. So we've got an anterior fontanelle. There's a posterior one here between the occipital bone and the parietal bones. There's a sphenoidal fontanelle on the lateral side, anterolateral it's sometimes called, near the sphenoid bone. And there's a posterolateral or mastoidal fontanelle on the lateral side back here. So those are important. Those end up filling in as the bones grow, though. Then, like we talked about those curvatures, right? They go back and forth. The primary curvatures are the ones of the thorax and the sacrum, and those are convex. And in fact, a baby actually has a C-shaped spine as opposed to that complicated, more S-shaped spine. And baby's not going vertical yet, so not supporting themselves, so the C-shaped spine is okay. But those secondary curvatures of the cervical and the lumbar regions, those ones, as the child goes into the toddler phase, etc., and starts going vertical, then those are the ones that develop secondarily. All right, so now we've gone through the big tour of the skeletal system. So I hope that helps. You can always refer back to this as you're going through the different structures and the bony projections of those bones that you have to learn in lab.